All right, so now we're recording. All right, today I'm talking about the lymphatic system. I'm going to teach a lot of stuff, but I want it to be a little bit more practical. So I'm going to get through kind of the basics of it, and then we'll get into some really cool practical stuff that you can do with your clients and on yourself, pretty much the same way, but some techniques that we may not have been aware of that actually conflict with a lot of things that I've done in the past. So I just want to clarify a couple of those things and why. And we will go from there. So there's 3 times as much lymph in our body as blood. And that's really important to know, because when we are dehydrated, it could be that we're not drinking enough fluids, but a lot of times it's because there's a lymph stagnation that's preventing the fluid from flowing correctly. The lymphatic system flows in a continuous loop in one direction. And so when you have that kind of stagnation, it prevents those energy flows. It prevents a lot of those different things from happening, whether that's your body detoxing waste, removing proteins from like waste proteins, and also out of a number of different layers of things there. It's 70% of our immune system. So when your lymphatic system is not working, when it's not able to move stuff through your system correctly, it can cause obesity, it can cause a lot of issues with shoulder and hip and neck pain, it can cause muscle tension, it can cause brain fog, it can cause toxicity symptoms, it'll cause a whole bunch of different things. Autoimmune systems, itises, inflammations, spinal pain, Lyme disease, all of those are related to the lymphatic system. Stress especially, so I've talked a lot about stress. Stress is going to cause tension in the body. And when you get tension in the body, you're going to compress the lymphatic vessels. So one of the things that I'm going to be talking about is when we do massage, when we do myofascial release, when we do any kind of body work, when we press really hard, we're actually closing the lymphatic vessels. And even though we can sometimes get a temporary benefit, it actually ends up to long-term shrinkage of those lymphatic vessels, just because of the nature of the trauma that we're creating. And our body needs that hydration delivery, it needs blood flow, it needs a lot of those different things, and it flows in a very specific direction that I will show you. So let me show you this real quick, just this quick image. And open that yet? So I'm going to show you this real quick. I won't show you super long, but I think this is a good image to see. So this particular image, what I want you to see here is, is when the outside here that we see is the muscle tissue. The red is the muscle tissue. And the inside is effectively the lymph tubes, basically, if you want to keep it simple. When we massage the muscle too strongly, we actually end up closing these valves. And so lymphatic flow can't happen. And so when we do massage work, and when we do body work, and when we do any kind of release work, most of the time it has more to do with lymphatic flow not allowing conductivity to hit the muscles than it does a muscle needing a deep tissue massage. Most of the time when we do a deep tissue massage, we're actually traumatizing the tissue, creating inflammation, which is actually going to result in the lymphatic vessels shrinking. Which is not what we want, because that is what leads to short-term benefit, but long-term issues. So let's see, how do I screen jump over here? All right, so now let me share this, because this is going to be the cool part. Okay, hopefully everybody can see this. We're going to actually go through the lymphatic system a little bit. So there's a lot of components to the lymphatic system. It flows really in one direction. So when I work with somebody, I'm going to work from the head down, even though one of the most important components of the lymphatic system is the calf pump. So the way that the calf is going to pump both blood flow and lymphatic fluid back up to the system. The left side has a lot of additional, well, actually, that might be backwards. The right side has a lot of, is kind of the beginning portion, and then it goes down the body, and then back up the left through the aortic valves, and then to the heart here. So what I'm going to do is just kind of go through from top to bottom so I can show you some critical points. You might notice that they overlay with different color puncture points in treatments, and then I'll show you how to find them on the physical body and what we can do to start moving lymph in order that way. When you have compression and stagnation, when you have stress on the body, that compression is going to actually cause your circulatory system to have to work harder. That's why when you have lymph stagnation, it also results in higher blood pressure. And so we want to get the lymphatic system working and flowing through all these different places so that we can start to fix all of the other underlying causes that are part of from the lymphatic system. So usually we start up at the head up here, and I'm just going to show you kind of where some of these different lymph nodes are. You can see that we have the nasolabial lymph nodes. These are probably going to be the second ones that we're going to treat. Those are on the creases of the nose. And I'll show you how to find those on somebody and how to find those on yourself and how to begin releasing them. When we do some of this lymph work, there's kind of we want to assess them by using kind of being mean when we assess, but when we actually go to work with the lymph fluid, we want to be soft and gentle because we want the body to actually hydrate. Most of these lymph nodes are just below the skin. So when we're pushing so far that we're actually damaging the muscle, we're causing actually a lot more stress and actually reversing the progress that we want to make. So you can see these ones right above the ear. The mastoid lymph nodes, these ones are right around the ear, which I'll show you. They kind of are right below where the SCM ties in, just below the ear, behind the jaw. And we have those on obviously both sides. And then we also have a couple of lymph nodes on the skull that are right adjacent to the occiput. So if you've done color, there's the spot where you can kind of see this protrusion in the center there. And then about 2 inches to the left and right, you'll see the the occipital lymph nodes on the left and right. There's some color treatments that work in there. If you tend to get tension headaches behind your eyes, it's usually because you have lymphatic tension that is being built up in this area. If you have sinus issues, it's likely that you have some lymphatic buildup on the front. And as we go through this, I'll continue to kind of tell you what things show up from stagnation in these different areas, because none of these systems work alone. So a lot of times when you have plantar fasciitis, it might be a lymph congestion in the hip. So as we go through, I'll show you some different images and different things where you can start to associate where these things might be tied in, so you can approach it maybe from a different perspective. Because lymph can certainly cause pain elsewhere in the body. So when you have a lymph stagnation near your spleen, you might be having shoulder issues, that kind of thing. So you can see as we get into the second place that we're going to work on is the jaw area. There's a bunch of lymph nodes right here, both in front of the jaw, this one here, the mandibular lymph nodes, as well as the ones that are underneath the jaw. Oops, trying to click those. And these tend to be really, really, they tend to have a lot of issues when you have like TMJ, you get some tension headaches, that kind of stuff. That's because there's lymph stagnation in some of these areas. But it might not just be these areas that are the problem. It might be because there is an issue with the neck. So when we start to work down here, you can see there's a whole bunch of lymph nodes that drain through the neck. You can see a whole bunch of lymph nodes kind of in this area, which is the first area that we're gonna treat, this whole area here. And how to massage those, get those to release, what we need to look for in someone's reactions when you start to palpate and work with those to see kind of what to look for when they have that kind of tension or lymph stagnation, and what those signs are. And then you can see that we work down the front of the neck. And then those run behind the clavicle. So when you have various postural distortions, you can see that if that clavicle is going, if that rolls forward, you're going to be cutting off lymphatic flows and doing some other things. You can also see in the front side of the thoracic spine that there is a whole bunch of lymphatic vessels running just along the inside of the sternum, connecting to the thymus, which is a really big, both where the azurate point is in our activations. It's also a big immune system organ. So as we keep moving down, the sternum has a whole bunch of lymph nodes right behind it. So there's a bone here that has a whole bunch of different lymph nodes where the ribs and the sternum tie in together. So we'll do some stuff on the sternum. And there, oh, I forgot one up here also that I'll get to. So there's also some others that it's not showing on this particular diagram, but it's on just kind of where you can see the top of this bone here. It's right next to the, what is it called? Drawing a blank on what it is, but it's above the orbit of the eye. So it's called the sphenoid, I think is what it's called. So there's some other places here that we'll work on. All of these need to be drained, and all of this stuff inside and around the clavicle is a really big bottleneck. So a lot of people will, when they have neck issues, be looking at the muscles in the neck and be working on a lot of the stuff that's in here. But if you don't work on the lymphatic tissue around it, there's not going to be any nutrient delivery, any hydration to these muscles, and that is usually what causes the adhesions, what causes the buildup and tension in these areas, and causes the weakness in the different muscles here. So moving on down, we can see that there's a whole bunch of muscles here connected to the sternum, all with lymph nodes that run through them. And then we start to see underneath the armpit here, where there's a whole bunch of different lymphatic systems underneath the right arm, underneath the armpit, as well as where the, man, I'm drawing a blank on my muscles. Where some of your subscap is, where the, what's the other one? This one? No, well, I'll find it later. But your pushing muscle, so the protraction of your shoulders, that muscle. Draw a blank on it, it's funny. So when there's issues in how the scapular moves and how these areas are functioning, a lot of times it's a lymphatic stagnation that's not allowing that to communicate correctly. Same thing is the case with the elbow. So when somebody has neck issues, when they have elbow tendonitis, all of those issues are related a lot of times to the lymphatic system around the elbow. And so when that happens, you tend to have a lot of stagnation in the pec as well. So we'll look at some of the connections between the elbow and the pec and the neck and the clavicle, and how those drain in particular and can cause a whole bunch of issues elsewhere. If somebody has elbow issues, a lot of times you're going to see mid-back pain, you might see shoulder pain, you might see some issues with the hands and the shoulders. So all of those kind of come up from that same elbow issue if there's lymph stagnation on the elbow. Around the clavicles, we're going to do a bunch of different things. They're kind of an important zone for lymph to flow. So when that gets stagnated, it's going to break a whole bunch of other stuff. And then there's some things on the pec itself. So there'll be some points on the pec itself with where we want to do some release work, where we want to do some lymphatic work, primarily on those lymphatic tissues outside of the sternum, usually right in line with the nipple as well. And I'll show you how to find those and how to begin doing some of that lymphatic work. And that will also allow some of the neck tension, some of the headaches, some of those things to start to make a little bit more sense. The spleen is the major lymphatic organ, so I'll show you how to do some release work on the spleen, and all of that is important. And then we get down to the what's it called? The chyli, I believe is what it's called. Yeah. So the chyli, the cisterna chyli, this particular point is where it's right below, it's kind of the epigastrum. It's right where the sternum stops and you get into kind of the soft tissue below your ribs. So kind of that entire area is extremely important for lymph. There's really big lymphatic vessels here. So when that gets stagnated, the pump going back to your heart gets blocked, which can actually interrupt the entire flow of the whole system. So it's a really important place to check and make sure that there is lymphatic flow there as well. Also, and as I go through these, I'll add other layers to it too once I show you how to release them. I just kind of want to show you where there's a lot of lymph in a lot of these areas, so that when we have low back pain, when we have gut issues, when we have neck issues, all of these are often related to this same area in the gut that is getting stagnated. And so knowing how to release the lymph in this area can allow hydration. It can make a really big difference in movement patterns and physical pain. Oops, can you plug that back in? Hold it up. So sorry, might malfunction. Oh, the whole thing fell out of people. Let's see if you can get it to it. Yeah, so I'm going to try and talk louder because my fell off the table, unfortunately. All right, so then as we get down lower on the skin, we have, like down here, we have the belly button. So around the belly button, the umbilicus, there is often a lot of tension related to gut issues, related to the psoas. So if you have a tight psoas, lower back pain, any issues with weak psoas, a lot of that will deal with things around the belly button. So we'll look at that and how to release the belly button. And then we get down into the lumbopelvic hip complex. Can you aim it a little bit better? That should be. You guys can still hear me? I can't see you, so hopefully you can hear me.
Who's there?
Yeah, we can hear you just fine.
Okay, cool. All right, so, all right, getting into the hips, we've got a lot of stuff that gets collected along the anterior, well, I'll just call it along the hips, along the ilium, along the different aspects of the hip. And so if we end up getting compression in this area, there's going to be kind of issues everywhere else. So learning how to release the lymph in both the above the hip and below the hip, and as it gets into the femur, you can see there's pretty big lymph nodes down here by the femur, along the adductor, and near the iliacus, psoas, all those. So if somebody has some of these issues that are kind of along the hip bone here, which we'll do some releases on. Can I click it? Click it. So when we have some issues in these areas, we tend to have hip pain, IT band pain. You might have groin issues. All of that can come from there. Then as we look at the iliacus and some of these other issues inside the hip, you'll start to see menstrual cycle issues in women. You might see prostate issues in men. They might have heavy periods, that kind of stuff, if there's lymphatic stagnation in these areas. As a little bit earlier, we have L1, L2, L3, L4, and L5. So if you have any low back pain in those areas, you can see there's a lot of lymph in those areas, and they relate to a lot of different organ systems. So that's important to also draw that connection. And then we get into the femoral area. So when you have weak adductors, you have tight adductors. All of that has to do with some of these lymph nodes that are at the base of the hip, or at the where the femur kind of inserts. And I'll show you how to find that really easily, and how to work through it and how to release that and get that lymphatic flow to happen. And then as we work our way down, the other really big place that people have is behind the knees. So there's some big lymphatic areas right behind the knees, that when that gets stagnated, the calves can't pump the lymph back up the body, and you tend to have all kinds of other issues that way. And the other thing that's really important to also notice is there's a whole bunch of lymphatic system right on the bottom of the feet, which is part of why people see a benefit from walking barefoot. It's not because it's structurally better for the feet, it's because it works the nervous system, it's because it gives input to the lymphatic system, and doing that gently can help to massage the feet so that the calf pump can actually work properly, getting that lymphatic system to flow back up to the rest of the body. And so one of the things that we want to know here is it's really common, and I have this in my hip mobility and other and shoulder mobility programs where you do myofascial release and you lay on a ball, but a lot of times that's actually going to long-term cause more harm than good, because as we start to really massage some of these areas, these lymphatic vessels shrink, and so the lymph flow degrades. The lymphatic system is very close to the surface of the skin, and so it really takes it doesn't take a lot of work to get it to move. And so I'm going to show you a couple of different techniques and processes that we can use on all of these parts in the order. And then after you do release of the lymphatic system, you always want to move. So movement moves lymph. Movement moves lymph, and so it's really important to do some movement afterwards, whether that's a biplate, but really there's a couple of just easy movements that I'll be able to show you. Spirals are always a good thing to do, to get a lot of this stuff just to flow and move through your body the right way. Okay. Let me see if I got all of these pieces good enough. All right, so let me have Anastasia come up onto the table here. Once I stop that share. Okay. All right, so all right, come on with your head up here, and then we'll move this way. And really face up. Face. Okay, so we can do that. All right, cool. So I'm going to show you kind of the order of operations here for how to release some of this lymph. You'll see that, oh, look at Kelsey, let me make sure let her in. Where this thing, where could you be? Up there. Are people asking questions? No. Okay, let me look at the questions real quick while I can see if I can find anything else. There it is. All right, so we had some questions. Is there a gut tie-in to lymph? 100% yes. That area behind the skull is where the headaches have been, especially on the right side. Oops. Yes, so there's a huge gut tie-in to lymph. When there's stagnation in the hips, you're going to get stagnation in the neck. Almost every physical pain is a neck lymph issue. When you have neck tension, it's a neck lymph issue. When you have shoulder pain, it's often a neck lymph issue, because everything needs to flow up through the neck, and then down through the other side through the heart. And so when you get stagnation in the gut, when you get stagnation in the hips, when you get stagnation in the anywhere along that signal path, it's going to create pains or symptoms somewhere else. So when you get headaches, like if you get tension headaches behind the eyes, all of that stuff can be part of part of that problem. Anyway, so let me see. Okay, so the first place that we're going to start. So everything we're going to want to do is you're always going to want to start by almost like rubbing up the tip. Everything is going to start soft. So the first place I'm going to look for, and hopefully you guys can see this, it's right in front of the jaw. And it's below the ear. You can kind of, if you push, it's kind of that gap in between there, between the muscle that's here, the SCM, or not the SCM, but near the SCM anyway. But it's the big muscle that's here that's easy to find, and then the jawbone. You're going to go in between here. And what you're going to do here is the first thing that you're going to do, if you're testing a client to see if there's an issue, you test hard, and then you're going to, and I'll answer your other questions, Scott, in a second. Test hard, and then you're going to do the treatment soft. So when I test hard, I'm basically rubbing in here, and I'm looking for a couple of different signs. If she winces, if she like squints her eyes, if she moves her feet, if she moves her hands, if she tenses up in some way, I know that her body is stressed and trying to protect itself. It doesn't take much pressure to get that to happen, and you're looking for any kind of subtle signs that way. And so when this shows up and she has tension on one side or the other, we always treat both sides. It doesn't really matter on the head which side you treat first. You're going to treat both sides anyway. And what I'm going to start with is like one finger, and I'm just going to go really fast up and down, kind of gently right on the surface of the skin, maybe for 10 to 20, 30 seconds. And just first warm up the area. And then I'm going to take my finger and I'm going to, or two fingers, and I'm just going to do kind of spiral figure 8 sort of motions in here. Might massage that a little bit more, a little bit up and down, side to side, just doing kind of circular or spiral motions right along the outside of the jaw here. And then you might grab like a toothbrush. I'm using a toothbrush head here. This is a really good way to do some of these. And then I'm going to just come in and I'm just going to scrape up and down all around in here. Then I'm going to do some circles. And then I'm going to do the same thing on the other side. So when I do that on the other side, same kind of game, rubbing very quickly. I'll just do it on both sides here really quick so I don't take up too much of the video. Now massage. Let's add more tension. So massage this side. The app I was using is 3D for medical, like 3D, number 3D, and I think it's the number 4 medical. It's an iPad app, but it's also on the PC and Mac. It's all over. I think they have a free version as well. And then I think I got the subscription, the year subscription, like for 50% off or something when I bought it last year. It's like 2 seconds away from expiring, I think. So then I'm using the brush after I've done the spirals and rub that. And then the next point I'm going to treat is going to be on the jaw. So the way that I can find that is if she clenches her jaw, it's going to flex this muscle on the side of her jaw here. Hopefully you guys can see that. So I'm, well, I take that back. There's one before that. So before I do that, I'm actually going to go below the jaw. So when I go below the jaw here, I'm basically going to be taking my fingers and kind of, if this is the edge of her jaw, oops, wrong hand, so I'll show you. If this is the edge of her jaw, I'm pushing up just gently underneath the jawbone, almost as if I'm trying to touch the inside of underneath her jaw. Don't need to press super hard, but enough that you can kind of test and palpate. If there is tension in any of these areas underneath the jaw here, or if you can feel lumpiness, that kind of tells you that there's some swollen lymph nodes in here. And you'll do both of that on both sides, just to see if that is doesn't need tender, so you have some tender and some on this side. And so what I'm going to do after that is the same game. So I'm going to go with my fingers, just take my finger here, nice and fast. So fast at the beginning, nice and gentle, but fast. You warm up the tissue. Kind of going back and forth along the jawline. You can do this on yourself also. So if you're doing that on yourself, there's, you just kind of use your thumb is a good way to do it on your own jaw. And then your finger, index finger, if you're doing it on that spot under your ear. And then after that, I'm gonna just go in gentle circles underneath. You can do both sides at the same time. There's no problem with doing that if you're doing it on yourself. And like I said, when you test, you're a little bit more aggressive. When you do, when you treat it, you're soft. You want to be nice and gentle in here. Just really only, almost like only trying to deform the skin, not necessarily trying to get into the tissues below it. And then same game, I'm going to grab that toothbrush. I'll come through. I'm just going to scrape this shit out. Same thing, circles, nice and gentle, really, just trying to move the skin around. A lot of times as we get to some of the other areas, you're going to notice that there are so you're going to find that when we massage some of these areas, you're going to see that the skin might stick in certain directions. And as we release that, we'll see that start to work a little bit better. So then doing that same process on the other side, leading to, so first moving really quickly. Just scraping the surface of the skin underneath the jawline, and then massaging in circles. One finger is usually enough. And then scraping with the brush. Usually you can build up to a harder bristle brush, but really any old brush is good. Some of the areas are going to be super tender if they need it.
And they tickle when it's
yeah,
when that stuff starts to move sometimes. Oh.
So that's underneath the jaw. The next point is going to be that point that I started to talk about. So she's gonna, if you have trouble finding it, she can clench her jaw and it's right in front of that muscle. So you'll feel that bump. You'll find right in front of it. You're gonna do that same process. You can palpate a little bit if there's some tenderness in front of the jaw. If they clench their jaw, if they have TMJ, that kind of thing, that might be tender. You can do both of those at the same time. You can relax. There, and then what I'll do is I'll massage that, hold it up. Just up and down the jaw. Now go in circles, nice and gently. You almost might think that I'm doing this so gently, how can it do anything? But that means you're doing it right. So like gentler is better. You don't need to feel pain. We've been taught that feeling pain is actually the thing that's getting it to move, but that actually causes the trauma on the body. And we want to be able to get that to move and release so the body isn't holding all of that tension. So a lot of times gentler is better. The next one, and then obviously same kind of game, up and down the chin. Using the brush. Same thing on the other side. Let me know if you guys need another view. I'll just pick up the iPad and show you a different view of it too. Just kind of say something because I'm a little bit far from the screen, so it's hard to see if you guys are asking questions. The next one is going to be on the nasolabial groove, which is those lines, kind of the lines that are on the edge of her face here. So the way that we find these, this is going to be kind of in line with the bottom of the nose, and it's in line with the pupil in color puncture. Really, it's actually in line with these, the lines on the face. And so what you're going to do with these points. These can be tender for people, so you start up by the nose. So I'm going to start up by the nose when I do that. You don't have to. I'll move this. And then I'm going to start just by massaging in here. This side a little more tension. So you're going to massage in here to palpate to see if it's tender, pushing harder when you test than when you treat, just to see what is there, working your way down towards kind of the lip. Then same kind of process. I'm going to follow this line. And then I'm just going to massage up and down, or just quickly rub up and down here. That same way. Same thing on the other side, pulling that up. And then massaging in circles. So just pushing in, there's some nerves in here that we also want to stimulate. Okay, massaging in circles, and then finally finishing with the brush. This can be really tender sometimes when they need it. You can close your eyes if you need to. So I might do this in circles, I might do this up and down, I might do it along the line. All of that is fair game. You can see some puffiness that shows up a lot of times if they need it. So if they have puffiness there, could be needing oh, the cheek one. Yeah, it can drain a lot, especially if you have sinus issues. All that kind of stuff is going to show up in stagnation there. All these points as well, you could probably color with yellow, with color puncture. Just doing some yellow. I wouldn't do it super long, but it can also help to get some of this stuff to drain in addition to the physical work. So you kind of work on all those layers. The next one is the sphenoid, and it's next to the orbit of the eyebrow. So if you go over to the side of the head here, you're going to kind of have a bone that you can kind of find, or it's next to the, yes, you're going to be able to go right next to the eye here. It's below the eyebrow, and around here you'll find kind of a ridge along here. And what you're going to do is you can palpate that. There might, yeah, if she winces, you know that she needs it. So there's some stuff in here. So she's wincing a little bit when you palpate. And so what you'll do is the same game. You might use the palm of your hand here and just massage up and down, get it to warm up. Same thing on the other side. Use your fingers. Towards the outside. And then I'm just going to massage in circles, gently.
Gosh, there's so much energy flowing. It's whoa.
And then same game with the brush. Close your eyes. I'll go up and down in circles. Brush towards the ear. Same thing on the other side. Circles. Okay. All right, The next one is the occiput, so I'm going to have you flip over. Well, maybe that's so the occiput. So we've treated that in color puncture a handful of times, but the easiest way to find it is it's that bump on the back of your head. So right before it kind of gets soft, you can go right above that, you'll find that little bump. And then from that little bump, if you go about 2 inches out to each side, you'll find that sometimes there's some tender spots in there. This can connect to tension headaches. It can be a really good place to do some tapping. So bone tapping can also be a really good way to get some of this to release. So you're first going to start the same way. When you massage this one, massage down kind of diagonally towards the ears. So I'm going to massage in a diagonal towards the ears. After palpating, then I'm going to rub quickly, gently. So it does not need to be strong. It's softer is better most of the time. So rubbing down towards the ears. You can take the brush the same way. Just brushing that across. Both sides. Usually feels really good. It's really good for releasing tension headaches, especially if you can get the stuff in your neck to release. And then finally, if you follow along this bone, really softly tap it. Just along that bottom ridge here, tap on the sides. I'm tapping fairly, very lightly. It does not take a whole lot. I'll tap up towards the back of the ear, and then I'll work my way back towards the center. Just do that maybe for 20 to 30 seconds. Back through. All right, so let me make sure. Nope. All right, so next one is flip back over. We're gonna keep working our way down. A lot of people, when they have neck issues, they tend to always work on the muscles up here, but the truth is most of the problems come down in the clavicle. So what we want to start by working on is the supraclavicular area, which is, I'm going to show you on this side. Bring this over. Actually, no, you're fine. Awesome. All right, so we're going to work first on the supraclavicular area, which is basically the area above the clavicle. This area there's a lot of lymph that flows through here, and when that gets compressed, none of this stuff from the brain can drain, and we got a lot of lymph nodes in our brain. So it's really important to get that stuff to move. We want to find the boundaries of the SC and the AC joint. So we've got those on both on those extremes, and then we are going to work on, well, generally we work on the left side, and we're going to do both sides, but you want to work first on the left side, then the right. So I'll do her left, and then I'll show you again on the right side. What I'm going to do is the same kind of game. You can palpate in here near the AC joint, working your way towards the SC, finding areas that might have some tension. I'm pushing kind of down underneath the clavicle. Not super hard, it doesn't take a whole lot. It's a pretty tender area in general. It's usually not the muscle that's tender, that's important to remember. It's usually the lymph that's causing a sensation of tenderness. So it's not a sore muscle most of the time. And then same thing, I'm just going to rub this up and down. You can kind of take this. The other way you can do this is actually to have both hands here and rub up and down along this way. But just taking this up and down, massaging it to warm it up. Do the same thing on the other side.
Is it possible to feel nauseous from this?
Yeah, you're going to be detoxing.
That's what I was thinking.
Yeah, so this can cause
We're
you to
there.
detox. It'll make you
We're
nauseous.
there.
I'm also outputting a lot.
You are outputting so much frequency. I feel it in my toes.
So you rub across the top, and then you're going to do little circles. Same game. This one, same thing, you can do that on yourself. Nice and gentle. A lot of times it's sore and tight, so you try to massage it really, really hard, and that actually makes the problem worse in the long term. So working on that there. And same thing on the other side. Working on those circles in here. And then I'm just going to grab the brush. There's another point that's basically a K27 acupoint, which is the same point that we see as yellow in the coordination treatments in color. It's also used for a whole bunch of different stuff. And that's kind of at the base where, kind of where we find the azure point. And so I'll add, a lot of times you can massage that as well. Just in here, warming up the skin. Doing some circles in here. And then I'll take the brush and I'll just rub across the top of the clavicle. There can be a lot there, so especially if you have a lot of lymph stagnation. The nice thing about these treatments is it can fix like a tremendous amount of problems really, really, really quickly. So just getting these things to flow can make a really big difference, and they tend to, if you can keep once you get a baseline, it should stick for quite a long time without having to redo it all the time, unless something starts to get stuck again, and that kind of thing. So. All right, and then we're going to do the subclavicular, which is basically the area below the clavicle. And when we palpate this, I'm going to basically we're going to kind of find the AC and the SC joint, which is kind of the ends of the clavicle. And we're going to go basically in the middle. In the middle, a lot of times just by palpating in some of these areas, you'll find one side, especially the left, tends to be a lot tighter for people. And just because that's the return side. And so when that gets tight, it can cause a whole bunch of other issues. So kind of what you're going to do is you're going to not push straight down. You're going to push as if you're reaching your fingers underneath the clavicle. And this has to do with, if you have shoulder issues, all that stuff can start to come in. If you get tingling fingers, all that stuff starts to happen from this area. So I'm going to push in, see if there's any tenderness, which there is on this side. And then I'm going to do the same thing, rubbing the skin. Remember, gently, it's not about, you rub fast, but soft to bring heat to the area. Same thing on both sides. Now, obviously, if you're doing this on yourself, you don't necessarily need to test and palpate. You can just go through and start with the fast rubbing of the area. And then I'm going to come in and I'm going to do circles. You'll probably feel some lumpiness and some little things there. Those are different lymph nodes that need it. So you get closer to the sternum, there might be some other ones that get a little bit tender. Just working your way along the collarbone. And same thing on both sides. You'll also notice that as you do some of this, when you pull the skin, might be hard to see, but when you pull the skin, you'll find that it actually starts to move differently as these things start to release, because you're getting that hydration in there that we want. You'll notice it more in some areas than others. Then same thing, grabbing the brush. Doing that on both sides. Okay, and then we are going to go to the pec. So what you usually do with the pec is you're going to find that center point on the clavicle like we just did, and then it's kind of straight down. So a lot of times it's kind of in the middle. It'll be a lot of times it's in line with the nipple, and it's going to be right in the center of the pec here. You might push down. It tends to be pretty tender with people. A lot of like CrossFit athletes and folks and people who do a lot of movement, they get in with a crossball and mash in, and what happens is they actually cause more harm than good because they're actually compressing a lot of these lymph nodes and actually making long-term healing a problem by preventing lymphatic flows in an important area. And so what you do, same kind of game, you're going to come in here and you're just going to do that same sort of thing, rubbing on the surface of the pec. On the other side. One or two fingers is usually good enough for a lot of these areas. And then you're going to do just circular massage in this area, just around that spot. Like I said, gentler is better. And finally with the brush. Okay. And then we're going to work on the axillary area. So that's kind of underneath the armpit. On this side, so I'm going to switch. Okay, so bring your arm up overhead for me. And what you're going to do here is there's a whole bunch of lymph nodes in this area. So you kind of are just going to palpate, yeah, doesn't take a whole lot. So it takes very little pressure here, just to palpate along the ribs, almost along that seam. There's a ton of lymph nodes that are in here, tend to get inflamed. And so if there is tenderness, the next thing that I'm going to do is I'm just going to rub in this area nice and gently, warm it up. Another area that people get in with a foam roller and mash it all up and cause compression. And then I'm just going to get in with 2 fingers and do some circles. And then we'll do the same thing on the other side. Start just by palpating that. So that's a little bit tender. This rib area is connected to lung, large intestine. Grief gets stored here a lot of times as well, so this tends to be tender on those kinds of people. A bunch of questions. All right, I'll check questions here after we get through this particular one. All right, so then massaging this side. And then same thing, circles, gentle circles. And then working on, you also can take the brush here. So if you have like a bathroom brush or that kind of thing, that works really well for some of the larger areas. Same kind of game. Okay. All right, and then we're going to look at the elbows. So hopefully, which one? Let's work on that one. Okay. Bring this elbow down. All right, so most of the time when somebody has an issue, they're usually complaining about this side of the elbow or this side of the forearm. But most of the time, it actually has to do with the lymph nodes that are on this side. So what I'm going to start with is you can just So a lot of times you'll palpate above the elbow just a little bit. You'll palpate below the elbow. It's a lot of gnarly stuff in there a lot of times. Then on it, kind of tends to feel kind of yucky for people who have some stagnation in this area. So what I'll do is I'll use my palm and I'll go up and down across the elbow. And come into the center a little bit, maybe. And then I'll come in and just do little gentle circles. So you don't want to cause pain. So if they are wincing and having too much pain, it means you're probably pressing a little bit too hard still. So it really doesn't take a whole lot of pressure. Gentler a lot of times is way better. I'll just keep repeating myself because I think it's important. Because we've really been trained to push super hard. So learning to be gentle in some of this stuff will make a really big difference. It also, part of the psychological element of it is it actually helps the body to feel safe. When the body always has to self-protect and splint and guard itself, it's not being made to feel safe, which is part of the problem in the first place because it felt unsafe. It had to guard, it had to compress the tissues, it had to create tension somewhere to protect itself. And so part of that goal is to teach the body to relax so that it can move fluidly and that kind of thing. And then you'll grab brush, and then you'll do the same thing over the top. And then do the other side. Get on the other side. Same thing on the other side. So just do a little bit of a palpation above and below the elbow. Let's see, actually, if I can bring the chat up on here. That may be easier. check and see what you guys are seeing. Oh, there we go. I can't. Okay, cool.
Oh, stuff is moving and grooving and it's like crawling underneath the skin. It's good. It's working.
Then rubbing on this side. And a little massage. First above the elbow. And below. And then grabbing the brush and doing that same thing. So brushing over the elbow. This can be kind of strong for people who have some of, like I said, neck tension, shoulder pain, hand problems.
You know what is stored here emotionally off the top of your head?
The elbows. I'm not sure off the top of my head. I have to think about it. All right, let's see what people are saying. Scott said behind the knees is interesting, which we'll get to in a second. So I talked about knees being here. There were big lymphatic stagnation point. Was watching one of the Qatar 2-3, and Yasha was talking about how they had her doing exercise and movement before giving her the activations because she needed to prepare her body for frequency. She mentioned the chakra behind the knee and other important areas, but didn't go into too many details. The lymph is super important. There's grid points, several different grid points that actually cross over the knees that are pretty interesting. So it's going to be a good one for a lot of people. I imagine people who have knee problems, who have problems elsewhere, like in their neck, might have some stuff stagnating behind the knees as well. So when we get there, I think you'll love hate that one as well. Yeah, I have to just the other day order toothbrush heads and just happen to have some extra ones. The lymph robot. That would be nice. Once you do it a couple of times, then standing on like a biplate or that kind of thing, or rebounding, is really good for moving lymph. Movement in general is good for moving lymph once the lymph is moving, but movement doesn't always get the lymph moving unless you can kind of get the stagnation to work better. It does make you tired for sure.
Yeah, I'm yelling like crazy.
Oh, the mental dream zone is behind the elbow. That makes sense.
Mm.
All right, cool. Next. Make sure we're in the right order. The sternum. Okay. So the sternum is a big one in neck, shoulder, back pain, all these kinds of things, because all of that stuff converges in the center. You'll find the sternum's easy to find, but you'll kind of go, you'll palpate along the sternum, just basically going along that center line. A lot of times it'll be tender towards the top, and not too bad in the middle, and a little bit more tender towards the bottom. You look for kind of lumpy areas. And then once you do that, you're going to go to slightly outside of it. So you'll go slightly outside of the sternum, kind of where the pec, ribs, and sternum meet. And you'll just kind of walk your fingers over those areas as well, looking for those tender points. This can get a lot of stagnation for people. It tends to be pretty tender. Yeah, so some of these areas can be pretty tender. Watch for them wincing. It can move a lot of stuff. And this is also a good area to do tapping as well. And I'll show you another trick that you can use in this area in a second. So first thing I would do is you're just going to massage I use a couple of fingers here. I'm just going to massage up and down, moving the skin more or less along the surface. Obviously, if you have female clients who are not your partners, ask permission to do some of this stuff and make sure that they're comfortable with that. Let me grab one thing real quick, and I'll show it to you. Whew. Another way to do some of this tapping fairly gently, works fairly well for some of these areas, is you'll grab a lacrosse ball and another hard item. I'm just happening to use two lacrosse balls will be fine. And I'll go below the AC joint on the sternum, and then I'll just gently tap, like really gently. Can a lot of times get that to loosen up. Maybe 5 to 10 taps in each of those areas. And then you might go into the shoulder, near the shoulder where the pec and shoulder meet, and I'll do the same thing. On the other side. Oh. And then you might go right below the clavicle again. So that area that we did right below the clavicle is another good area to tap. I'll just go below there. Nice and gently. That way. And so that's just another option to do some of those areas when you have bone. You don't necessarily want to do it. There's a couple areas you do it on soft tissue, but it's better to do that one on bone. And then once you release that, once you tap it, then you're just going to massage in circles. You go and massage along the sternum first. Yes. So female breast tenderness is a lymphatic issue more than anything. A lot of times when you have like the chest band is a really big lymph band just in general. But when you have lymph stagnation, whether it's in the neck, whether it's in the kind of the breast region, it can get tender. It can have all kinds of issues that might show up there. It can also have other psychological issues that relate to that in general.
Women store so much here, so much like stored emotion. It is if you find any good, well, I have several breast massage courses that are fabulous for releasing some of that stuff and then releasing a lot of like shame stuff that lives there.
So massaging that, when you do the sternum, you want to go, if you go slightly off the sternum into kind of the groove there, those are even better areas to just gently massage kind of in between the ribs. Not too hard, there's a lot of lymph nodes in there. And just gently doing that same sort of process in there. And then you can grab your brush again, do the same thing along the sternum. In that way. The other thing about, a couple of things about the sternum in general, when this gets stagnated, when the sternum has an issue, when the muscles attached to it are not hydrated because of lymphatic flow issues, you're going to have thoracic rotation problems. You're going to have kind of mid-back pain. You might find puffy areas or tenderness, whether that's in the pec or in the back. Yeah, so same thing, neck, shoulder, back pain, like upper back pain tends to also anchor there when the lymphatic system is not flowing in that position. And now we're going to look for the spleen. So the spleen is only on the left side, so we only treat the left side in this particular case. This is the only thing that you treat only on one side. And what you're going to do is if you find the ribs, the spleen is just slightly up from the ribs. So I'll show you on this side, even though it's not on this side, but here's her ribs. And you'll kind of go up into a couple of, just probably a couple of inches diagonally from kind of that center point in the ribs. And the spleen is under that section. So it's going to be under here. And what you'll do is you're just going to kind of palpate in between the ribs. If you have trouble finding it, that's okay, because we're going to basically massage that whole area. So what we're going to do is use your palm, and you're just going to rub that whole area in circles along the ribs, on the left side. Warm up the area. And then you're going to kind of work your fingers a little bit in between the ribs. Probably some tender spots in there if the spleen needs some work. But it is the controller of your entire lymphatic system. So it's always a good idea to get that to move. Our lymphatic system is our psychological buffer. So a lot of times when you're doing some of these lymphatic treatments, it can bring a whole bunch of stuff up that wasn't moving, can bring up a bunch of energy because it's your energy flow system. So when the energy isn't flowing and creates stagnation, it shows up in your lymphatic flows. So all of this is a really good idea to do, whether that's between color treatments or with color treatments, just to get that to move. It tends to fix a lot of issues in people across the board just by doing a lot of that work. And then same kind of game, after you've done that massage and warmed up the area, then you'll just grab the brush. You can use your bath brush the same way here. Then we're going to do this, the kind of a chi point. It's basically in the center of the epigastrium. There's a lot of nerves in here. So the ribs anchor here. This is the bottom of the ribs. For people, this is usually a really sensitive spot. So just kind of even just light pressure a lot of times will cause people to guard. And you'll see that happen.
You grab some water and
Stand by for commercial.
stand by for commercial break.
Okay. So what we're going to do is you're just going to kind of using 2 or 3 fingers, you're just going to palpate this area. It tends to be pretty tender as you push down underneath the ribs on both sides. Just looking for those tender areas. And this is another one of those areas that when you treat it, you don't need to go very hard. You're just going to very gently rub the surface of the skin here along the epigastrium, just very gentle. Talk about the lemons. They thought those were lemons. The balls. All right, and then same thing with the brush. And along the epigastrium. Okay. Now for the belly button. Down. Okay. So now we have the belly button. This tends to be a pretty tender area also. And we're basically going to make like a 2 to 3 inch circumference and work in that area around the belly button. And we're just going to start by, we're going to start outside of it and just palpate. Look for like if her feet twitch or if she clenches or any of these areas that kind of feel tender. You can see that there's some of these areas that don't feel quite as good. And then I'll work my way in closer to the belly button. Just pushing in, there's a little bit more tension in some of these areas than others. Yeah, definitely need the OJ pump. I didn't bring my OJ. Palpating that. And then a couple of things you can do. This is a good area to tap. So if you just gently tap, roll. You can also tap with a flat hand. That tends to work a little bit better. Okay. And then just kind of gently massaging the skin. Do the same thing. This is really good for if you have digestive issues, headaches, all that kind of stuff can kind of anchor into here. And same game with the brush. Working out in a 2 to 3 inch radius. This is another one of those areas where the aggressive zones and some other things in color, there's a lot of color treatments that revolve around the belly button. Combining those can actually be really good if it's lymph and emotional lymph related. So kind of there's using 2 fingers diagonally out. You have green, green, and green is a really easy, good way to do that. There's also a rhythm that's crimson, light green, turquoise, and rose. And I'm drawing a blank on what order those are, so I'm not going to tell you off the top of my head. I think Scott has that one, so he might be able to tell you.
And your Yumbi is here too, so it's
Yeah.
like connecting a lot of.
So obviously this is the false navel. We have our Yumbi point that's kind of just below it. We have the Dantian that's between those two. There's a bunch of different energy points that are right in this area. So massaging those and getting those to release can be really helpful. And let's see. All right, the iliac crest. So the iliac, when we look at that one, I'll show you on this side, is you're going to find the hip bone, and you kind of trace that hip bone diagonally this way. So if she was to like lift her leg, you would see that muscle, sort of the hip flexor, not that far, just slightly. You can put it down. It was just a show. Just a demo. All right, so you'll find this muscle here. And what you're going to do is kind of go on either side of that muscle. Yeah, so it's going to be really tender for a lot of people. Just pushing in to either of those areas along that muscle. And on the outside, this tends to have a lot of IT band issues when this gets stagnated. And so you can kind of just push in here. You'll find a lot of different areas of stagnation just by palpating in that particular area. And on the outside of the hip, and just following that bone. So you can kind of, this bone is here, you can kind of walk along that bone, and on either side of the bone, you'll find that there's some tender areas as you kind of trace that. And there's also a lot of tender areas. If I follow the bone up around the hip here, going up underneath is another area that you kind of palpate and look for some of that tenderness. And they usually have a lot of stuff that doesn't feel so good in there. And so that is another one I'll do. Just massage.
Hips are.
Hips are your program. Hips connect to everything. So if you have gut issues, if you have headaches, if you have neck issues, Always check the hips because the hips are going to be a main kind of through port of everything that comes through your body. So I start just by massaging gently, making it hotter. It's better to do it right on skin, but it depends on kind of who you're working with. If you're doing it on yourself or whatever, warming that up on either side, and gently just kind of doing gentle circles. Like I said, gentler is better. A lot of times we really want to dig in deep in here, thinking that that's going to be better to release it, but it really takes very little pressure. You can see that I'm kind of barely even depressing the her clothing or whatever as I do that. Working my way through there. Tends to be a lot of tenderness in these areas. Tickles a lot of times too. Up and down that line. And then I'll do the same thing on the other side. Testing for, so testing for tender spots, just following that line. So same kind of game, rub across that. Following that line. Scott shared that treatment, so for those listening to the recording, starts in the upper left, lower right. So upper left is going to be crimson, lower right is going to be light green, upper right is going to be turquoise, and lower left is going to be rose. So if you're watching that, I'd love to give that one a try, and you have the kits. That's another good one to do around the belly button. And continuing with following that hip, then rubbing, and then gentle circles in some of these areas. You'll find a lot of tension in some of these places too. A lot of times when you find a lot of tension, the reaction is to push super hard to get the tension to release, but it's actually better to be gentle, like I keep repeating. But good to drill it into you because I think we've really been programmed to push hard and dig into it, and that's why the body keeps guarding and won't release. So being gentle in a lot of these areas is going to make a bigger difference. So when these tend to work, so you tend to have groin issues. From this one, you tend to have IT band issues, hip pain, all that, low back pain, hip pain, knee pain, foot pain, all of these kind of anchor into this area. So if somebody's having foot issues, if somebody's having low back and hip issues, obviously we check the gut too, but pay attention to the hips as well, because that's a big pathway for that lymph to flow. And so if we're not releasing it, you might be missing some of just kind of a bottleneck that's showing up somewhere. The next spot is the around the adductor. So to show you, she's going to bend her knee. This might be hard to see, but it makes it easier for you to find it. So she's going to push her knee that way, or adduct the leg, so that our internal rotates, so that she can get that muscle to show. So if you have trouble finding it, that's an easy way to find it. She can relax it. And what you're going to do is you're going to go above it. So you're going to massage above it. A lot of times there's a lot of tenderness in one side versus the other. It's going to follow that muscle down. Above and below that. And then you're going to go below it and do the same thing. This tends to get be pretty tender for people in certain areas. And it's very common to do a lot of like myofascial release to try and get the adductors release. Same game, keep that gentle, working on that surface. Weakness only leaves the body when you let it, Dave. If you're beating it up, you're putting it back in. Massaging that. You can also, same thing, scrape that area. Okay, then you'll do the same thing on the other side. So you'll find that same muscle, go above, palpate for tenderness. A lot of times one side might be more tender than the other. You can see that there's, oh, you can't see her face, but she's wincing from some of these. So some of these tend to be more tender than others. Watch for them to wince. Absolutely make you itchy. That means lymph is starting to move.
Yeah, so itchy.
Yeah, it'll make you super itchy for sure. So that means stuff is moving. It's actually friction on the surface of the skin. And then same game. Rubbing. And then gentle circles. Figure 8 motions, those kinds of things. Dry needling is not going to necessarily help with lymph, but it might help the fascia restructure, which might indirectly help with lymph flow. I think for most people, dry needling tends to be pretty traumatic just because it hurts so much. And because of that, it will ultimately cause more stagnation than flow. So I think a case-by-case basis, it depends. Some people get really good results from it, but I think it's also possible to cause people to have, because anytime you puncture the body, anytime you get a cut, anytime you have surgery, all of those are physical traumas that whether you feel traumatized, the body remembers trauma. So it's kind of important to contextualize the human depending on what you're working on. Sometimes dry needling can be a quick fix that is fixable just by moving lymph that will get the pain to go away. Because like I said earlier, most of the time pain has nothing to do with the muscle that we're trying to needle or the fascial adhesions. It has to do with the lymphatic system not flowing. So just getting that to flow can make a bigger difference than anything else. Both in terms of physical health, but also in terms of just pains and that kind of thing. All right, next. All right, so now she's going to flip over. We're going to do the back of the knees. Let me have you actually put your head up first. Okay, so the back of the knees are a really big place for lymph to stagnate. When we palpate these, I'm going to go just a little bit above the knee. I'm just going to work on above the knee. Mm-hmm. That can be really tender for people, especially if they have knee problems or hip problems or foot problems, also fear. Definitely, if you can try moving lymph first, it's way easier and gentler on somebody's system. And honestly, it'll work just as quickly for a lot of people. So it can be a really good first step to give them a really big movement in the right direction. So I'm going to go above the knee, and then I'm going to go below the knee. Just palpating for tension, palpating for tenderness, if she flinches, any of that kind of stuff. You can also, a good thing to do here is to slightly bend the knee. You can relax and do that with a bent knee. Do the same thing.
Oh.
So there's some areas that are pretty bad for people sometimes. So when you find that, then also in the center of the knee, so you're going to go above, below, and then center. Yeah, so a lot of people, the calf connecting into the knee right below it is really gnarly. So right above, below, and then center, and then same thing in the center, palpating. And then I'm going to do that same game, massaging, warming it up just across the knee. Create some heat. Do the same thing on the other side. Knee slightly, testing the points just to see if there's any tenderness. Then below the knee. Yep, so that tends to be pretty tender for you every time. So below the knee and then inside the knee can be pretty bad too for people. Then relax the neck. Fast and light. The best way to do this one, if you're sitting, you'll sit and put your knee straight on something and then work on behind the knee this way. So like so, and then massage it that way. And then what I'm going to do is I'll just do little circles here, little figure eights. The thing to pay attention with some of these, so I'll go above the knee, below the knee, and then in the center again, when I'm massaging and doing that circle. If you have somebody in shorts, you can see how their skin moves, and a lot of times with this area especially, the skin will move very differently as the lymph starts to flow, and you can start to pay attention to how the skin moves. Ask for a back at the knee rub later. You rub my knee pits.
Oh, okay.
So same thing on the other side. So if skin is feeling a little bit numb, there's a lot of nerves that collect back here as well. So just moving the lymph will help to hydrate those nerves and get the nerve supply to improve. Same with any of these areas really. So as you move the lymph and you're moving the skin around, that will improve that hydration. All of that should start to improve as well. Peter sells gold and silver crystals. There's some crystal treatments that you can do on the back in front of the knees. That might also help to get some of that stuff to move. They're really strong, so don't do it super long the first time you do it, because the crystals work on super deep, super ordinate stuff. So they can bring up some fears and subconscious stuff, but they tend to be a little bit more subtle if you haven't peeled some of the other layers yet. So they're either really, really strong or you don't notice a whole lot. The crystal treatments are really, really good if you've not done any of them well. Some of them they're kind of expensive. I don't know, like it kind of depends on what you're doing. Most of the treatments that it gives you with the crystal, like when you buy the crystals, are not worth it. I've gone through some of the Crystal Bardo programs and some of the other like really big crystal treatments that were worth it, but those you can't do on yourself. So the answer is it depends. They're really cool in concept, but you might be able to solve those problems in other ways also. So after you've done those, there's a couple of others that you can do that are really good. Let me see. So the first one is actually on the jaw. There's a point on the jaw that connects to the glute max. So you would basically where that muscle was when you clench your jaw, you go slightly to the back of that, and you'll massage that area the same way that I showed you earlier. You would do that after you do all of these other points, and then you would be able to go and do that particular one. And I'm going to show you another image in a second that I think will be very interesting to you. Did I not save it? I think I did. I have to see if I saved it. I hope I did. I may have just taken this from the chat. All right, so the next point that we're going to do is basically the lumbar, basically the dividing line between the thoracic spine and the lumbar spine. Let's flip around actually. Okay, and so that is basically at the bottom of the ribs. You're going to find it right in the middle here. And what you're going to do is, this is basically between L5 and T1. You're going to start with the same process. I'm going to rub to warm it up. This one is a really good spot, right below the Saturn points in the middle of the back. So if you tend to have mid-back pain, you tend to have kidney issues, this is a really good spot to work on. This is where a lot of people will foam roll and mash all this stuff up and get it to stagnate. So it's not a good spot to foam roll. Much better to do some of this gentler work, warm it up. It's really right outside of the spine. A lot of color treatments, kidney pulls are right in that area too, that you can treat in red. And then once you do that, doing little circles, same way, just gently massaging the surface right along the outside of the spine here. This one's a little bit harder to do. You might be able to do this with like a tennis ball up against the wall and just be gentle with it. This is one that you probably have to get done, but you can be creative. Maybe you might be able to use like a Theracane also, if you can be gentle with it. And then same thing, brushing. Brush horizontally, vertically. Circles. And we'll see. Then there's a point on the sacrum. So a lot of these points, I'm going to show you a diagram in a second. I think I should have saved it. And those points, there's a lot of relationship between like the feet and how they tie into hips and how that ties into different areas. And there's kind of, this foot ties into the back of this hip and this hip ties into the front of this. So you can see some of the spirals and how that maps. This next one is on the sacrum. So the sacrum, a lot of times if there is lymph stagnation, you're going to find the two bones and it kind of creates a triangle between those two bones and the tailbone. And so there's a lot of nervous system that goes through here. There's a lot of lymph that goes through here. And so you'll start just by warming it up. I usually go horizontally across. It's another place that you can tap. And then you'll find kind of the top ridge of the hip bone here, goes slightly below that. There's a lot of times there's just some tender spots right in that area, which is just kind of a couple of inches outside of the spine. So when you have, this connects to a whole bunch of stuff, so it can actually associate with a lot of things. So I'll massage in there. Massaging the tailbone is also another good thing to do. Coloring it with turquoise is another good thing to do on the tailbone. And there's all of there's basically all of the endocrine organs are also flipped upside down for the tailbone. So all of the things that are on the head are also mapped out on the tailbone and on this area as well. So there's a lot of endocrine stuff that anchors into the sacrum in that way. Same thing, massaging, brushing, rubbing, and going that route. And then let me see. I think there's one more. Yeah, one more. So C7, T1. This one is that bump on the neck. So that one's usually pretty easy to find. You can see the bump on the back of her neck here, C7, T1. You'll massage on the outsides of it, so to the left and to the right of it, maybe slightly above and below. Just kind of massaging in here gently, warming it up, both sides. And then, I'm pretty sure it's anything else. And then the other thing you can do is kind of rub over the entire part. So I'll get my palm, I'll just rub over the entire area there. This is a really good one if you're getting headaches, can help some of that drain. Some gentle tapping on this area can also help. You can also tap up and down the spine, gently, down to the sacrum. Back up, there's a lot of things that can get to move, especially if you do that at the end. These are also really good, just drainage points. If you tend to have a lot of neck tension on the front of your neck, it's usually related to C7 in this area. So massaging this one and getting this area to strengthen again can be really, really good. And now so the thing to do after this, once we've kind of moved some of this lymph, is to actually do some diaphragmatic breathing. One of the best ways to do this, why don't you flip over? Actually, I think you should go. So what she's going to do is she's going to take her right arm and she's going to reach across her ribs. Take the left arm, you're going to bend the knees and grab the hip here. So she's grabbing this hip and slide towards me a little bit because you're going to twist your hips that way and actually scoot down. Actually, not on the just back. Okay, maybe. All right, and then from here, what she's going to do is she's going to twist her knees that way. Yeah. So keep your arm here, keep this arm pinned on the ribs, keep those knees down. And then she's going to look to the left or the right, both. She's going to do both. Then she's going to do breathing through her nose. So she's going to breathe in and out, and she's going to look for restriction in the ribs when she breathes. So doing this kind of technique can help teach you how to breathe through your diaphragm by pinning the ribs down in that way. You're holding that across. And then she'll find restriction, then she'll turn her head the other way. So go ahead and turn your head, breathing in and out through the nose. Finding where there's restriction, it might be easier to breathe in one side more so than the other. Moving the diaphragm, because it is connected to so many different aspects of your lymphatic system, will be a really big part of this process. So having people do diaphragmatic breathing after doing all this lymphatic work is really good. She's going to switch sides. So other hand comes across, the knee switch to the other. Don't just twist. So lay on your back. So reach across, pin the arm with the other arm, and then reach straight down, pin it, yep, to the hip, not to the back of the leg, and now twist. So keep it. So don't twist your whole shoulder. Try and keep this out. Yeah, so that is the whole idea, is to keep that pin so you can only breathe through certain areas of the ribs. So from here, same thing, looking one way and breathing in through the nose. And then looking the other way, breathing in through the nose. Let's see, below, knees, prefix, reach. Yeah, Theracane lacrosse ball are really good tools for that. Yeah, so there's a lot of, there's several treatments on the ears in color, like the endocrine OGT is a really or ear endo is a really good one. I can send you guys if you want to try that one. Another endocrine treatment that maps on the ears that I really like, really calming, uses the neurasthenia line across the forehead and then maps some stuff on the ears. Yeah, so the twisting and stuff is really good. The twist, spiral stuff moves a lot of lymph in general, which is why it does what it does. But we need to make sure the lymph is actually moving before we get to do some of those movements. So a couple of things that you can try that I'll share with you that you can do at home. So I think, yeah. Can you help me fold this really quick? All right, so a couple of things that you can do. Because the handle's on the other side. I'm just going right here. Hopefully this will work well enough-ish. Okay, few things that you can do. The first one is just working on the contralateral movement. So in general, in this way, basically. The first one, a little bit. Okay, first one is just reaching across the body. Really just easy movements, does not take a whole lot, reaching across. You can add any fancy spiral stuff that you're working on. It's really just to work on the contralateral movement here. You can also, if you're working with a client who's like really beginner, literally having them reach as they walk, reach to the opposite leg, reach, reach, reach is a really good way just to teach them how to reciprocate that way. Doesn't need to be super complicated. Most times the fundamentals and the simplicity is going to make the biggest difference. And that's kind of what we want to aim for. So the next one is backwards, and then you're going to reach opposite. Oh, hamstring cramp. Right, so same game, reaching backwards. Right, and touch the heel. Usually you'll do like 50 of those. I'm just going through them pretty quickly. So you want to do a lot of those. That way, the next one, let me think, what was the other one I want to do? So the other one, you're going to get in a lunge. Let me see if I can get in a place where you can see my back foot. You're going to get in a lunge, it's slippery. And then what you're going to do is you're going to have your arms up overhead. You're just going to do like a calf raise forward and back. And this works that calf pump aspect. And like I said, there's a bunch of other stuff you can add to it if you want to make it super complicated. But like I said, simpler is usually better. Same game on the other side. Same thing. Oops, bounce. Should be this way, actually. Oh, you can't see it, I guess. Yeah. So lunging down, working on the calf, sending my weight backwards and forwards through that too. I think this one actually feels pretty good. Just getting the ankle and calf to move that way is good for a whole bunch of stuff. Getting the calf to work. And then I will do okay. And then what I'll do, another simple one, sideways, reach up, overhead, behind, touch C7, bring the arms down, up, overhead, bring the arms down the body, up, overhead, arms down. And just doing that works kind of through the whole entire system that way. Really simple stuff. A couple of other kind of fun ones that you can do. I've said this before, but you may not have caught it. I don't remember where I said it. When you look at a computer, a lot of times your eyes are staring in the same place, and the muscles connect into just below the occiput. They connect into this area. So you'll find when you move your eyes, you should feel a little bit of a muscle movement on the back of your head. So moving your eyes around while massaging this area can help to get some of this stuff to release. The other thing is your tongue is really tightly tied both to your neck tension and to everything leading all the way down to your big toe. And so doing weird shit like grabbing your tongue and stretching it out side to side. And so stretching your tongue out pulling it side to side, sticking it out, moving it around can also help to release a lot of this stuff as well. So moving your tongue around, stretching it, doing all that can be really good too. The other thing, a couple of other just kind of ones on top of what we've already done, grabbing on the neck and just dragging gently forward across the collarbones is another way to get some of that stuff to drain. And I'll do that every once in a while. That feels pretty good. And I'll also run I'll run down, kind of pulling the, just kind of what is it called? What's the bone? I don't know what it is, but just kind of dragging that down a little bit to release some of the muscles in here, because these can kind of get tight, especially if you're talking a lot too, or working with a lot of clients. Getting that to drain can also be really good for getting a lot of that stuff to release. So what questions do you guys have? How do you like this session today? It was a little bit different than what I usually teach, but I think it'll fold into everything else we do. Because if our lymphatic system is not flowing, our energy is not flowing, and we're going to have all kinds of other physical and mental issues that come as a result of that. So we want to keep that moving so that as we do the activations, we do color puncture, as we do all of these other layers of things, that we're actually getting it moving, clearing our system. Because a lot of times, even though we might do the lymph rhythm, that may not be enough. So doing a lymph rhythm on top of all the other stuff can really be good. When you do it for yourself and you do it every day, it takes very little time. It's kind of, most of the time we'll do it in the shower. I'll just kind of go through all those points initially when I'm in the shower, for 10, 15 seconds each, and work through that whole thing. So all of that is really, really helpful. It's made a difference for how my body feels in general and everything else that way. It can help if you're trying to lose weight but can't, because if you can't detox your body, if your lymph system isn't working, your body's going to store toxins in fat, and then it won't burn the fat because it doesn't want to release it into a lymphatic system that's not working. So the more you can work on the lymphatic system, the more all of those other systems can start to work and hydrate and all that kind of stuff. So it can help you heal a lot of stuff that seems unhealable, whatever. So question away.
This question's slightly related.
Whatever you'd like to ask.
Something you mentioned in the beginning. Last week I came across something odd, and it was interesting, and I haven't really had time to look it up, but it was saying that the heart isn't primarily a pump, and that it was physically impossible for the heart to actually pump blood throughout your entire body and overcome gravity and whatever. And it said the heart actually vortexes blood in your
lungs,
veins.
The lungs and the heart work in spirals. So they do vortexes. They open to pull things in, and they close to move it. The same way our chakra spirals work in some ways, right? So ideally it would be continuous movement, but because of the way that system has been distorted, it pumps that way. So in the body, it can't pump it completely because most people have lymphatic stagnation. That's why the calf pump is so important. That's what works to send that blood and that lymphatic tissue back to the heart. And like I said, there's 3 times as much lymphatic fluid as there is blood in your body. So when people are looking in the wrong place, a lot of times for hydration, for symptoms, for that stuff, lymph is really important. Probably more so than almost anything else in the system when you consider the energetic aspects, the mental aspects, the detox immune system aspects. All of those things have to go through the lymph, and that's a really big bottleneck. Beyond that, I'm not really sure. I just know that that's probably true because of the calf pump necessities and how lymph works with it, whatever else. What else? Any other thoughts?
Anything else you do for your headaches lately? Because I used to have crazy headaches when I was a kid, and then for years I didn't have headaches. But the last month and a half, and even more so the last couple of weeks, I've been having a lot of headaches.
Once the trumpet pulse kind of is done and the next one starts, we should get a little bit of a reprieve from the energy and headaches. But we'll have other inhibitions that are going to show up with the 5th trumpet. So a lot of it is frequency, and that frequency is, if you think about it, it's very high frequency stuff that's going to shake loose the lower frequency things that are imprinted on us. If our lymphatic system isn't flowing, guess where that stuff gets stuck? If we have stuff that's stuck, then that is going to build up and it's going to create headache symptoms because our body is a fluid force system. So one of the things I mentioned earlier, when your lymphatic system isn't flowing, whether it's in your gut, in your calves, or somewhere else, that puts pressure on your venous system. And if the veins get pressure, your blood pressure builds, all those things start to happen, and you get headaches as a result. So making sure that you're not only hydrated, but your lymphatic system is moving so your body actually absorbs the hydration can make a really big difference on headaches. So the one I showed you, if you are getting headaches, releasing the collarbones, and really just the neck in general, but releasing the collarbones and the pecs, and then the C7 area can be really good, even just tapping it if you can't get that to massage. So getting lymph to flow from the upper body, especially once you've done some of this lymph stuff to begin with, you've gotten your hips open and the armpits and that kind of stuff moving better. Doing this area and then putting like a hot pack on C7 can really help to get that to drain, and usually that drainage will get stuff moving again and help with the headache. A lot of it is frequency also. It might be food. You might need that's why salt helps, because you might have needed energy or food in some way. And a lot of times by the time you get a headache, you needed food a while ago. So, you kind of have to play catch up and whatever.
I'm wondering too if I maybe just need to wake up earlier and then start eating earlier too, because I'm eating a lot. But I'm wondering if it's just a timing issue. If I just need to be up at 6 a.m. or 5 a.m. and just be eating.
It could be. I've been getting up super early. Just my body's getting up super early, and the sleep and dreams have been crazy the last couple of weeks anyway. And I don't have a headache today, but a lot of days I have been getting a headache, especially kind of later in the day as the day goes on. Doing some lymph stuff usually helps. Sometimes it's telling me I just need to, rest for 20 minutes or something, and doing that usually will also calm the headache down. So there's a lot of layers of what it could be. I would try doing the lymph stuff, do a little bit of like basic spiral type movement afterwards to move the lymph through. And also understand that if you're doing a lot of frequency and activation work, plus all the frequency that's coming in, you're probably pushing your system a little bit, and it's reacting to that as well. There's some color treatments that involve the kidneys that also can be good for headaches. I think coordination 10, which is the trauma points that are in my treatment program, can be pretty good for headaches also. I need to look up what the other ones are. There's a couple of them that might be good for headaches, but I don't remember them off the top of my head.
Yeah, I've been able to kind of control them a little bit for the first couple of weeks. Sometimes they would get really bad and be unbearable. I've been able to do things to control them, and sometimes I'm literally like just eating salt, and that seems to help for some reason too. But
yeah, I think it's an energy thing. When you consider how taxing these activations are on our system, I think a lot of times we forget that we're just bringing in frequency. It's not that hard, but it really is a lot of work on our system. And there's more layers of our system than just our physical body that are operating. And so sometimes when we do a lot of it, our body is like, okay, yeah, I know that you just think you did an activation and now you're going to go get to work, or you're going to go, do this thing you wanted to do, as if it was less than what you were doing before. But sometimes you just need to sit and do nothing and let that pass through, just because it is really taxing on the system. And if you're not sleeping on top of it, or any of that stuff is coming up, then that'll all have overlap. It's usually not, and that's an energy thing. When your body's asking for salt and the salt fixes it, means your body needs energy, or needs to be able to process that energy in a certain way. So that could mean sitting and being still with the salt and letting that push through. Could be that you needed a certain type of food, and could be a combination of those. Also,
with clients doing this treatment, how often would you do it with clients, and would you just kind of do it to show them how well it works, how effective it is, and then tell them that they can do their points on their own?
So it depends on where you're doing it and what you're allowed to do. You know, you can certainly teach your clients and do it side by side. If there's an issue, you know, like some people might be upset if you're not a licensed massage therapist or any of that kind of stuff. If they don't care, I mean, I've done it with clients all the time, but just make sure that you ask, you know, you ask the right permissions. You're not making them uncomfortable or anything like that. What I would say is do it once and go from there. Do it once, teach them how to do it on their own, explain maybe the layers of how that works, and also interweave it with everything else you do, in the sense that, you know, it's important to work your lymphatic system, so that when we're doing color, when we're doing movement, if we just do movement or we just do color, but your lymphatic system isn't flowing, all that stuff's going to get stuck somewhere else because you have that bottleneck. And so we're doing this so that we get your bottleneck open, and that kind of thing. And so, like, you might find that you do it once and it just works to solve the problems that they want to do in a lot of different places. And then you can be, and then, you know, adjust accordingly. Because I think a lot of times setting a hard goal that says do this every time or do this once every month is not really necessary. You'll find that, like, start with doing it once and see where that leads you. And if you get the ping that says, maybe do lymph for them this time, because you can tell that they're having the same adductor issue come up. They're having, you know, the same shoulder issue come up. See if just taking them through that gets that to go away, gives you more information, and then you can actually just adjust what to do from there once you see what the results are. Because usually the movement of lymph and stuff is pretty quick, or at least it'll give you more information. You know, it may not fix it, but maybe you're working, testing and palpating their knee. You're like, oh, okay, I'm seeing why you're having this hip issue, or I'm seeing why you're having the shoulder issue. And so you might use it as an assessment as much as a fix for whatever it is they're dealing with. Does that help?
Yeah, for sure. So if someone was tender behind the knee and you thought it was because of like fear and anxiety that's kind of being stored up, so that might help like alleviate, like maybe they
keep asking. I'm going to walk out of the frame for a second, but keep talking. I can hear you.
Okay. So, and then you find that moving the lymph at the back of the knee helps alleviate some of their knee pain. You probably still need to work on the programs if they haven't worked through those that cause that problem, or else the knee pain will likely come back.
Yes. So it's all a kind of like, no system works alone or no system heals alone. So if you only fix one thing and don't take into context the other layers of what's coming up, then it's pretty likely that it's going to keep showing up in one way or another. There is. Did I close that? I must have not saved it.
But at least that'll kind of tell you that it's more like lymph or motion related rather than movement related. So you kind of know what to focus.
Right. And that's kind of part of the, let me see that. I'm just looking for an image somewhere. Hopefully I can find it. Oh, bummer. There. Give me 1 second and I am going to show you something. And ask any, if you guys have other questions, you're welcome to ask. I'm just looking for an image that I meant to show you. But I think you'll like it a lot. Is it cursor? Oh, there it is. All right. Oh, it must be on that screen.
So if someone has knee pain and maybe I didn't want to take them through the whole lymph thing or have to like convince them that I want to spend a session doing that, maybe I could just do it behind the knees, or would that not be as effective because you're not starting at the top and kind of working around?
It depends on how often you've worked with them. So if you've noticed knee pain, you have information, either you have information about them already, or you have no information about them. So if you have information about them and you're already drawing conclusions, then go to the place your intuition tells you, which might be the knees, it might be the hips, it might be, you know, like just kind of painting some of these pictures. If you were my mouse, where would you be? Oh, it's on the wrong screen. There it is. There it is. All right. Lucy just asked, talking about trauma and doing the lymph work got me thinking about the winged scapula and its relation to chest trauma. So compressed ribs, it's going to stagnate lymph. Compressed ribs, it's going to rotate the shoulders forward. It's going to compress all the lymph that goes through the collarbone. It's also going to be a closed heart chakra in certain ways, meaning this section of the spiral is going to not be outputting as much, and the antiparticle aspect is going to be outputting more. So there's an imbalance somewhere in the energetic and how you're showing up in that. So part of the game of trauma is understanding the energy imbalances that show up through their behavior and through the mindset and through your own kind of things there. So when you have that, looking at the postural distortions that manifest on the surface, can start to say, okay, this is where I have some healing coming up. Because right now everybody's doing heart healing just because of the fourth chevron, the fourth trumpet pulse that's spiking right now. So that's showing up in relationships, that's showing up in self-love, that's showing up in how you show up at work, that's showing up in how you love what you do, that's showing up in how you question the things you're supposed to be doing, that's showing up in all of those different layers. And so you're being given opportunities to say, oh, am I withholding? Am I living in lack? Am I trying to receive from somebody else instead of giving that to myself or giving that to others? Or, where is the energetic imbalance in a lot of these things that are coming up? Really, we don't need to go looking. A lot of times when we just set the intention to begin that healing work, the universe brings to the surface what we need to be looking for at this time. The mistake we make is thinking, oh, okay, I have to heal, let me get it done. And so you start thinking there's this checklist that you just go through and check things off as if there's that formula. But really, there's a framework and a frame of reference that you can use to say, am I off balance? But really, the universe and your higher intelligence delivers to you what you need to be working on at any given time. And what that means is you're not in control of what comes up. You're not in control of what you're working on. Your job is to notice what you're working on a daily basis. So every day you have stuff that comes up. Every day you have contrast. Every day you have interactions that push you to learn a little bit more about yourself and your traumas and your programs, so that you can reframe and re-empower yourself within them. Getting like the physical manifestations are really like kind of surface level symptom, but they can start to lead you to the areas that you need healing. So that, okay, you recognize this, you're like, okay, I have some heart healing. What's been coming up lately? Oh, I've been having this kind of discussion with my boyfriend, or I've been having this kind of discussion with my boss. I wonder what that has to do in terms of heart healing. What kind of things am I doing that I might be withholding? What kind of things am I doing where I'm operating in a scarcity? What kinds of things am I doing where, I'm trying to disconnect and separate myself from people rather than connect? And so it can help you ask some of those questions to lead you kind of to what might be coming up, and what, if you're having all these gut issues, what emotions are coming up, what mental body stuff are you not processing, and understanding how that stuff all cycles and flows can be really good. All right, let me show you this one real quick before I let you go, because I think you guys will really like this image. Okay, this is cool. I'm not going to go too in depth with it because I literally just found this today and I haven't really even studied it. I just noticed that there were some really cool correlations. So the easiest ones to see are, you can see that you have points on the hips that then relate to a bunch of these other areas of the body. So the points on the back of the body and on the spine relate to certain other organs, other muscle structures, other joints, all that kind of stuff is interrelated and spiraled around the body in that way. if you look up the I think it's called Chapman points or Chapman lymph points or the Chapman point system. With that, you can really find a lot of really cool information. But I thought this was a really cool concept that's worth looking into, so you can see how the scapula on the back of your body relates to the adductors, it relates to the serratus, it relates to the infraspinatus. So it does a lot of different things that we may not have looked at in the larger scheme of things. So the hips, how they tie into the knees, you can see that the knees tie into the rectus abdominis, and all that kind of thing where your heart healing shows up in the knees, right, for that reason. And so you can start to see how these neurological connections start to match with the spiral, start to match with the emotional symptoms that show up, so that you can start to say, oh, they're having this pain. Well, what else does that talk to? And then you can start to map it in more than 3 dimensions and see, the human aspect of what's coming up. So I'll let you guys kind of Google that, or you can freeze frame this image and take a look at it a little bit more, since we're getting kind of long today. But hopefully you guys enjoyed. Oops, is that not sharing the right screen? Oh, can you guys even see that? Hopefully you're seeing the correct one. I hope you guys are. You guys are seeing the neurolymphatic points, aren't you?
Yeah.
Okay, good. I thought I shared the wrong image, and I was just talking about something you guys are looking at me looking crazy. All right. So yeah, so that's kind of cool. And I have no idea what the mouse is now.
It's on the TV.
Okay. So there's a lot of different things there. That's a really cool image to look at. You might be able to use that to map out some of the color stuff. Like, kind of the idea is that as I build these different layers here, you'll see where the color puncture treatments come from. And eventually when I talk to you guys about color and where the colors map to, what the different pieces are, you'll start to understand, oh, this is how the organs connect. This is how the nervous system connects. This is how the physical body connects. This is how the lymphatic system connects. This is how, all these different things then map out 3-dimensionally, and this is how it maps out emotionally. And so you kind of have this really big map for how all these things interrelate and connect. I kind of tend to know it intuitively with a lot of these things, but as I've been building it, it's starting to prove itself by just mapping a lot of these concepts. So play with this stuff, see what comes up for you guys and what you learn from it. I played with those also. So there's a lot of really cool things that start to come in that I think you guys will like, just from an understanding standpoint, and kind of being able to visualize the whole thing. And if you have other questions, just ask them on the Telegram, and we'll kind of keep chatting about it and digging into it and play with it and see what other, go through this and see what comes up. So, all right, guys, I'll talk to you next week. And
That's all.
ta-ta.
See y'all.